Tips after bariatric surgery. One thing that you want to confirm after your surgery is you want to make sure that you have gotten all your prescribed medications. Also, if you are resuming home medications, you want to make sure that you have been instructed to do so by your provider. And of course, if you have any questions or are unsure if you should resume a medication, always ask the provider first. When you are recovering, you've had a big surgery. So at times it does take a little bit to recover. It can be a lot on your body, emotionally, physically. And so you want to allow your body time to recover. You don't want to do anything strenuous for around 3 to 6 weeks. You want to make sure that you're up, moving around, walking as much as you can. And then you can also do climb stairs, do some household chores, as long as it's not completely depleting you. And of course, as long as it's not causing too much discomfort. You do, however, again, want to make sure that you're up, moving around, walking as much as you can. This does help the recovery phase. It helps reduce some gas. It also helps, the big reason, to reduce the risk of developing a blood clot. So you always want to make sure you're up, moving around as much as you can. Digestion changes can be common after surgery. We'll talk about that in other videos, but definitely you could expect to have some constipation or the opposite, loose stools. So the best thing to always do is you want to make sure that you're hydrating as well as you can be. Hydration would be getting in at least 64 ounces of fluid. You want to make sure that you're avoiding extra sugars, alcohol, which you shouldn't be doing post-operatively, and also fats. Hair loss is also common. Usually hair loss peaks at around 3 to 9 months post-operatively after your surgery. You may resume sexual activity as long as you feel physically and emotionally ready. One thing with bariatric surgery is that ultimately weight loss, fat loss can help improve your fertility. So you want to make sure that you're on a form of birth control for at least 18 months after your bariatric surgery. It is not recommended to become pregnant within that 18 months. You want your body to be at good optimal level to help achieve a sustainable pregnancy. After your surgery, you could experience a common yet frustrating side effect called constipation. Constipation can be very troublesome, especially because of the type of diet that you're on. You're getting in high protein, limited fluid intake, and compared to the protein to hydration ratios that you once had, things have changed. With post-operatively, the biggest thing that you want to do to help constipation is make sure you're getting a good source of fluid. Hydration is going to be key. You want to make sure you're getting at least that 64 ounces of fluid intake to help with constipation. If you are prone to constipation or you start having trouble, there is the prescribed lactulose that you can take. I recommend taking it starting off, and then if things don't get better, you can add it to do twice a day. But you want to take the lactulose twice a day until you have a bowel movement. If you do not have a bowel movement, you can always add in additional fiber. A fiber substitute like Benefiber, Metamucil can be helpful because you're not getting in enough fiber initially. You're just doing protein and fluids. So as you transition to the pre-rate stage, you're going to be able to start getting a little more fiber in. But this is something that's good to help increase your fiber intake, to help hopefully get things moving. There's laxatives that you can also take. A good laxative to start with would be Miralax. And you can use any store brand or drugstore brand, generic brands of these medications. They're all essentially going to help do the same thing. Smooth Move tea or Senecot tea can also be helpful to help get things going. This is a good source because you're drinking it. It's kind of can be nice and soothing. Hopefully it'll help get you going. If you can't get to a point that you've had a good bowel movement, the next step would be to either take like a Dulcolax, like this one here. If Dulcolax doesn't seem to be helping, or you can do like magnesium citrate, milk of magnesia, These can help all go, but if those aren't working, then I would go to doing a rectal suppository, like a Dulcolax suppository, glycerin suppository. If that's not help, then you can go to doing the enema. One thing about enemas or even the suppository that I often get is that patients don't know to the proper administration and then the proper time frame to wait to try to go. When you utilize the suppository enema, you want to make sure that you hold the medication for at least 30 minutes to an hour after insertion, and then you want to go try to get rid of it. With the form that you want to have with the suppository, you want to kind of have a diaphragm here. You want to make sure that you're laying on your left side. If you go to the other side, then the medication is going to seep out. So go to the left side, lay on the left side for at least 30 minutes, and then go try to use the restroom. Again, the biggest thing that's going to help post-surgery is making sure that you're hydrated. So that's going to be the first thing that you do. Then, of course, we prescribe the lactulose. So that lactulose, you can get that going, take it 1 to 2 times a day, 15 milliliters, and that's going to be the most successful thing to help you go. Loose stools and diarrhea can be common after bariatric surgery. This can be due to high fats, high sugars, lactose, medications. So if you're having loose stool, first off, look to see if there's anything that you can eliminate that's causing that loose stool, like the dairies, fats. If that's not helping, you can add in a probiotic to see if that will help. From there, you can slow down with what you're eating, make sure you're chewing well, avoiding anything, of course, that's going to cause that gassiness, like extra fiber. And then also avoid, again, any dairies, sugars, fats that could be causing that irritation. About post-op hydration strategies. After surgery, it can be a little tough to get all the fluid in, especially as you're healing and trying to accommodate new life after surgery. Sometimes it can be a little tough to even try to just get basic water in. So I'm going to go over some tips that may help. One thing you want to do is the goal is to get at least 64 ounces of fluid in per day. That includes your water, Crystal Light, Gatorades, anything that is fluid, but not including your protein shakes. That goes towards your protein, not your fluid intake. So you want to start off by setting a timer to drink every 15 minutes. You want to get in around 2 ounces. That includes 2 medicine cups or 1/4 cup of fluid. This is going to help keep you hydrated. If you stay on that plan, you can even set a timer off your phone or your watch. There's even water jugs that light up, and you can program at the time to like say, hey, let's drink. All of these can help get that intake in. Sometimes it's going to take really just staying focused and pushing the fluids, because if you get sidetracked or if like you're at work, it can be tough, especially if you get busy. So you want to have something that's there reminding you to drink. Sometimes if it's easy, instead of doing the little medicine cups, you can change it over to pour the fluid into like a cup. So that way you know and you can see how much fluid is actually in that cup. And then you just add it up at the end of the day. But again, the goal is to get to around that 64 ounces. Sometimes different fluids may kind of affect you differently. So you can add to do like some Crystal Light, you can do some Mio enhanced flavoring. You can also change the fluid temperature. Sometimes warm fluids like teas can be a little soothing, and other things like popsicles could be better for you. It just kind of depends on what works for you. Again, you want to find fluids that are there to help you and that help you get your intake in. So some things that could not be as helpful would be caffeine. It can dehydrate you, so it can actually cause the opposite effect. We want you to be hydrated after surgery, so if you're doing a bunch of caffeine, it will dehydrate you, so we don't recommend doing caffeine. Again, the goal is to get in at least 64 ounces of fluid. So just try your best. Initially, it may be tough, but each day try to do a little bit more. Kind of set a goal of like, okay, I only did 30 ounces yesterday. Today, let me do 35. And really push each day to increase your goal so that a way you can eventually get to the goal.